The RiboX study is an investigator-initiated trial run through the Prostate Cancer Clinical Trial Consortium, evaluating the combination of ribociclib, which is a CDK4/6 inhibitor, with enzalutamide, an AR pathway inhibitor, in men with metastatic castrate-resistant prostate cancer or androgen pathway modulation-resistant prostate cancer. It is a phase 1b/2 study evaluating the safety and tolerability of the combination, as well as efficacy in taxane-naïve patients with androgen-resistant disease. The primary endpoint is safety and tolerability, as well as a PSA 50 response rate at 12 weeks. Secondary endpoints included radiographic progression-free survival, PSA survival, and overall survival. The study demonstrated that the combination therapy was well tolerated with a randomized phase 2 dose of 600 milligrams daily for the ribociclib, along with standard dosing enzalutamide. No dose-limiting toxicities were observed, and the toxicity profile is consistent with each drug individually. Notably, there was neutropenia observed with ribociclib, but none requiring growth factor support and no evidence of neutropenic sepsis. In terms of efficacy, the combination trial outperformed enzalutamide monotherapy in this population. However, the primary endpoint was not met, and no statistical or clinically significant conclusions can be drawn to support utilization of the combination over enzalutamide. The combination of ribociclib with enzalutamide for a subset of patients demonstrated a disease-stabilizing effect with evidence of prolonged overall survival. It is likely that the biology of these patients was affected by the combination, but the utilization of the biomarkers for the study, which is intact RB by immunohistochemistry, is not sufficient to justify utilization of the combination therapy. Further investigation is warranted to identify biomarkers beyond RB-IHC, potentially cyclin-dependent kinase expressions, to identify patients who may demonstrate benefit from either a CDK4/6 inhibitor with an ARPI or novel investigational agents targeting cyclin-dependent kinases.